Okay, here's some interesting things I found about this new Obamacare health bill, which is really like a health insurance reform bill, not so much healthcare reform, although they seem to have got their tentacles into absolutely everything. But basically it comes down to making people buy insurance, although it does raise the threshold for which people will qualify for subsidies. So if you're at 133% of the poverty level, you can get subsidized healthcare, which would include like Walmart employees. So Walmart won't have to cover them. You will have to cover them. Section 4106, improving access to preventive services for eligible adults on Medicaid, and it's all about vaccination. 4204, immunization, the section on immunization. This is all about vaccinating adults, and it goes on to talk about programs where the Director of Health and Human Services will provide grants, so the federal government will provide grants to the states for their vax programs, which will have as a goal to increase vaccination coverage. And they mention in Section D, they'll be doing things like assessing vaccination status, giving on-site vaccinations and incentives for vaccination, like take this flu shot and we'll give you a free pen. Home visits for vaccination in Section E. All states will have electronic databases for vaccination records. I'd like to mention, you ever heard of the e-government readiness program, courtesy of the UN? They have this scale, and when you reach 1, you're ready. You're not done, you're just ready. It's supposedly like about making government services electronic, so like you can do your taxes online, things like that. But part of it also is making vaccination records electronic. And like I said, once you meet all the criteria and you get it 1, then you're ready. Ready for what? E-government. The states then who receive this funding will have to evaluate their program after 3 years and then report to Congress after 4 years on the effectiveness. So basically, they get money for vaccinating as many people as possible, and if their program doesn't work, then they get their funding cut. So they're probably going to want to vaccinate as many people as possible, and we're talking adults here. And, you know, what are they going to do? Mandatory vaccinations? Or when we said incentives, incentives like you get something if you do it, or maybe you lose something if you don't? Anyway, this could result in decreased health freedom for adults. Here's another really ridiculous section, page 455 to 456, regarding restaurant food labeling. Okay, basically they're going to make it mandatory to label what they call the nutritional content of the restaurant food. There's a heavy emphasis on the calorie content, and then they say they got to put it in a context where like people understand what this amount of calories means, as in like what percentage of their diet. But calories, it's not about calories. What about nutrition? So they're going to put nutritional labeling on restaurant food for restaurant chains. Well, what's going to happen? People are going to look at this thing and say, oh, it has 8% of my daily recommended allowance for potassium or calcium, and they figure it's good. It's maybe kind of misleading. They're going to think that the stuff is actually food. Oh, yes, and it's not going to include labeling for additives, which I think is way more important than labeling for calories. Why is the government telling restaurants to label the calories? Oh, I know. It has something to do with Codex Alimentarius. Oh, yeah, and the RDA guidelines, which are so low to begin with. It's like meaningless. So it'll tell you it has a certain percentage of your RDA for whatever, but so what? It's not enough anyway. Okay, case in point, you already have labeling on like the pizza bites and your chicken wings and all that stuff. And people know how many calories are in that. They eat it. They get fat anyway. Oh God, it gets even worse. They're going to have labeling on vending machines. What a waste. It's really simple. The only labeling that should be on the vending machine is contains junk, eat at your own risk. I mean, what's the point of labeling your different chocolate bars? Like, so people are going to go, I'm going to make an informed choice. I'll read the label. I think I'll have the Reese's instead of the Mars bar because the Reese's contain more protein. Okay, page 458. They're going to have demonstration program concerning individualized wellness plan. The government's going to give funding for like 10 community health centers to do these programs where they're going to assess your overall status with various ways and then help you make changes. I'm concerned about section V, small v. It'll involve dietary supplements that have been approved by the secretary. So now the Secretary of Health and Human Services gets to approve what supplements are valuable. I mean, what the hell does she know? Okay, page 463. It's all about public health surveillance systems. They're going to collect data on absolutely everyone and everything about them. And it says something here about lab test results being reported electronically. So what, like you're going to get your cholesterol levels taken and it's going to go directly to the federal government? Okay, this one is really disturbing. Page 496, Ready Reserve Corps. It's like militarization of healthcare. They already have a commissioned corps. It's like a military corps, but for healthcare. But now they're going to have an extra one, Ready Reserve Corps. Okay, this was brought to my attention by the YouTube user Charlotier, so thank you very much. I'll put some extra info in the sidebar. Here's what it says about appointment. Commissioned officers of the Ready Reserve Corps shall be appointed by the President, and commissioned officers of the Regular Corps shall be appointed by the President with the advice and consent of the Senate. So this is kind of like, where they wanted that extra corps. Okay, the President's going to appoint all these people. It looks like they're going to get it. Okay, page 218, home visits, federal grant program. They're going to come into your home and assess how you're taking care of your kids and stuff like that. It's to prevent injuries, maltreatment. We'll see how that turns out. You're going to get grants for this program, but you'll have to demonstrate improvements in cognitive, language, social, emotional, and physical development indicators. Okay, I don't see how this is going to work unless they stop vaccinating those kids. I mean, how are you going to have improvements in all those things if you're poisoning the children? Okay, they overlooked that. Okay, they're going to have a personal responsibility program, page 229. So what, sex education, like pregnancy prevention for kids 10 to 14 and 15 to 19. They also talk about trying to reduce the pregnancies in women under 21. I don't know why. It's not a bad thing to have a baby when you're young, but you know how they are. Okay, educate teens on abstinence and contraception. They're going to have they're going to reinstitute funding for abstinence programs. Okay, I just like to point out, Joe Jonas says he's burning up, he can't hold himself back, and he knows you want it too, or something like that. Okay, so Health and Human Services is going up against the Jonas Brothers. So who do you think is going to win? Okay, abortion. I'm not really clear on what the bill does for abortion. It doesn't prevent abortion from happening or from being funded, public funding. Okay, page 779, maybe you can figure this out. It says there's section B1 where public funding is not allowed, and B11 II where abortion for which public funding is allowed. So clearly it's allowed in some cases. Basically it looks like the federal government is leaving it up to the states to decide how they're going to handle this with abortion, and it's possible that to get funding, if the state doesn't fund it, you'll just have to buy additional insurance. Oh yeah, these people are depopulationists, so don't forget. So they're going to make sure that people have access to abortions. Don't worry about that. That's one of their big goals, Planned Parenthood, all that stuff. So yeah, for sure they're not going to make it hard for people to get abortions. I'm going to give you a link also to a website which explains a lot about the bill. I'll just put it in the sidebar, and basically it doesn't look good. It's just like about health insurance broadly, but like I said, if you look at the details of the bill, it's like they've got their tentacles into absolutely every aspect of life. And it's all about electronic records, surveillance, data tracking, funding, which then gives them control over various programs or various aspects of state government, things like that. And on this website, they say basically that you have to pay 8% of your income for insurance. If you don't, the IRS will charge you 2% of your income for not having paid it. And I saw Nancy Pelosi being asked by a journalist whether it would be fair to send people to jail for refusing to buy insurance, and she basically said yes. So that's the kind of tyranny stuff that's going on here. I don't think people are going to be very happy.